Welcome to this episode of Your Lifestyle is Your Medicine. Today we talk to Shane Steadman. He is a chiropractic neurologist, and a functional medicine practitioner. And what that means is he is brilliant at bringing all the different systems together and really finding out the root cause of health. So today we talk about the difference between functional medicine and standard traditional allopathic medicine. We talk about what's most important in the hierarchy of exercise, health, nutrition, stress management, and relationships, and avoiding toxic substances. We talk about things like migraines and how to manage them, pre-diabetes. We talk about the fads in healthcare at the moment, the biohacking and perhaps how it's not necessary. But what really is necessary is to be strong in the foundations of sleep, exercise, nutrition. This is a very practical session where Shane shares a lot of wisdom, and I know you're going to enjoy this one. Shane, welcome to the show.
Thanks for having me. This is going to be awesome.
Yeah, I'm excited. Now, what I'm excited about is I'm an osteopath and you're a chiropractor, and there's so many different paths that people can take in our respective professions. But you have gone quite specialist as a chiropractor. You're a functional medicine practitioner and a chiropractic neurologist. How did you go from regular chiropractic to where you are now?
You know, my mom, I always have to start the stories there because when I was in high school, my mom worked for chiropractors, but she ended up working for a chiropractic neurologist. And I remember all the stories that she'd come home with and, you know, the things that I saw. And obviously I played sports and I was adjusted by him and worked on. And then my wife, who was my girlfriend at the time, she was in a car accident, had a bunch of like neurological imbalances, and he worked on her. And so I remember that. And I was actually in undergrad as a music major. And halfway through, I was like, I want to do what that guy did. And so that's kind of when I said, you know, I want to switch majors and go into pre-med, and I want to become a chiropractic neurologist. And that's kind of was my whole goal was, you know, it's like I knew that I had to get my chiropractic first and then get my neurology second. But then, you know, kind of in the course, and people ask me this all the time, like, well, how'd you get into functional medicine? Mm-hmm. And that was because I really truly believe that to be like a doctor of the brain per se, you have to know a lot of things. Mm-hmm. And I think, and jokingly, I think that's sometimes what makes some of the neurologists egotistic. But truly in this realm, my thought process was like, if I'm going to work on the brain, if I'm going to understand the brain, then I need to understand everything that can impact or influence the brain. And so then I went into the functional medicine route so I can start learning all the different aspects of hormones and thyroid and blood sugar and autoimmunity and, you know, gut function and everything that's involved in that, so that I can be a better chiropractic neurologist. But now it's like, now my practice has turned into, I don't know what's wrong with you, go see Steadman. And so right. We just combine the brain and the body and everything all in one.
Well, it is combined though, isn't it? And I think that that's one of the problems we have with the traditional medical model is that, you know, oh, you got a problem with your lung, go and see, you know, someone who specializes in the respiratory problems. You got a problem with your gut, go and see a gut expert. You got a problem with your musculoskeletal system, it's a musculoskeletal expert, but they're not separate. So with functional medicine, how do you contrast what you do with, let's say, you know, a standard allopathic doctor?
Yeah, and that's definitely a great question because a lot of people struggle in the allopathic or traditional or conventional. So obviously people listening to this will hear those different terms, but what we're kind of suggesting is that in that traditional model of medicine, it has become more of like a specialist type of healthcare where you go to your primary and the primary is then kind of required in an essence or encouraged to refer up into a specialist. And so everything goes primary specialist. And I think what happens in that realm is everybody says, okay, well, they even say this, stay in your lane, you know, yeah. And medical professionals, I mean, even in osteopathic medicine, I mean, they even said, stay in your lane. And by that definition, then people don't cross over. They don't say, hey, you got a brain issue. Could there be a thyroid reason? Oh, you have a brain issue. Could there be a hormonal component to this? Nobody does that because you have to stay in your lane or you kind of get a talking to, so to speak. Mm-hmm. And so I think that's what the patient is now experiencing is that I have to go to 6 different doctors to get a holistic view, but none of those doctors are talking to each other. And so I think in the functional medicine approach, I think what a lot of practitioners try to do is say, well, let's look at all of these different systems and how do they integrate with each other, and what can we do to improve the person's life. And for a person with, let's say, migraines, person A, it might be hormones. Person B, it could be blood sugar. Person C, it could be digestive. Another person, it's trauma. Another person, it's stress. Another person, it's sleep apnea.
Mm.
But the same person came with a migraine, but they all have different causes. And that's what the functional medicine world tries to identify is, if we can figure out the different systems involved, we can identify the causes. And if we can identify the cause, now we have a treatment plan.
Mm.
And I think medicine, I think the intention is great. And and if you talk to most medical professionals, their intentions are great. A lot of them also get frustrated with the system. And I think that's what the patients become, kind of a victim of the system. And that's what really makes it tough. And that's the difference between your allopathic traditional medicine and your functional medicine.
Yeah, that's so interesting. It's like, so like that patient example with the migraine, they come into their primary care physician and they say, okay, well, you had a concussion a while back. Let's maybe it's to do with that. Go and see the neurologist. All the tests come back clean, and the neurologist is like, no, it's not that. So then it's like a ping pong or whatever it is, that one of those
They
games
pass
where
the baton.
yeah, it comes back and it comes back and it comes back. Whereas what I'm understanding from what you're saying is that, well, hang on, if you just come to one person who looks at all the systems, you might not have to sort of have so much heartbreak and disappointment because you'll be able to find the cause probably faster and more efficiently.
Yeah, absolutely. And I think those of us who in this world that really try to understand the whole person, I mean, it's a lot of education, a
Mm,
lot of learning, but I think it does make the patient's life easier.
mm,
I can sit down and go over their lab work. I can go over hormones and what they should be. I can go over neurotransmitters and how they should be and what they're responsible for. And then we can talk about stress and say, is a counselor needed?
mm,
Like we can sit down and go through all these different pieces, and I think the patients are looking for that because really at the end of the day, it's going to save them time and save them money, versus most patients say, I had a 15-minute appointment. And you talk to most medical doctors, and they don't even like that. They say, I had 15 minutes, 7 of it, which is paperwork. I got 8 minutes to listen to the patient, diagnose them, and give them a treatment plan.
yeah.
I couldn't do that in 8 minutes.
No, exactly. And then they're seeing 40 patients a day, and how can get to know anyone in that amount of time?
It's hard.
Yeah.
It's really hard.
It is hard. And it's interesting, when I went to school in the UK, we were taught very carefully not to be rude about the medical profession, because it's not the individuals. You're right. It is the system, and the system sometimes can't see. Well, the people fall through the cracks, and we would pick up the people who fell through the cracks, and we'd be like, oh, I can't believe the doctor didn't pick up on this. And then our teachers would be like, well, would you have seen that in 15 minutes? It took you 5 treatments in an hour per treatment to pick it up. So no, you wouldn't have got it either. Okay, so how does it look then? Someone comes to see you. What's the difference between sort of your initial consultation and a consultation in the traditional medical model?
Mine's a little bit more detailed, but I'm biased, obviously, so I
Mhm.
think this is how it should be. But when people come in, my goal is to get all their old records and old labs, radiology report, imaging. So my goal at the end of the day is trying to collect data,
Mhm.
right? So the more data I have, the better decisions I can make. So I try to grab all of their old records, and then we have intake paperwork that's really detailed, but it goes through all the different reviews of systems. And from that point, we actually do our history on that. Because I think if patients give us, kind of the high level, so to speak, then we can start going deeper into that. And so I think sometimes practitioners like try to do everything from scratch, but patients, when they have a history that they have to fill out and they have to think about, sometimes a lot more things come out that you weren't aware of.
Mhm.
So then we'll do a really thorough history, and then we'll do a really thorough like structural and a neurological exam, which looks at like eye movements and vestibular function and balance and motor and sensory and all of these pieces. And then we couple that with maybe, I mean, I love blood work. So if there hasn't been blood work in a while, I love running a comprehensive blood chemistry, because that gives me an idea of what's going on in the patient's body. So it's kind of like plugging your car into the computer code, the system to get a code,
Mhm.
and then the code tells you what's wrong with the car. I think blood work has that capability. And so, we'll run blood work like that. I might look at viral panels, hormone panels, autoimmune panels, but we just basically I collect all of his data on day one. And then I actually go over that. So I probably spend another half hour or so, and I'll kind of go through each of those, data points and go, okay, this is what makes the most sense. It's probably not this. And then develop a treatment plan off of that. And then usually the next visit, I go over, here's my thoughts, here's my findings, and here's the treatment plan moving forward. Because I think at the end of the day, what's important, and you don't even see this in functional medicine sometimes, is I think you got to have individualistic. Everybody's an individual, so each should have their own plan. And too often you see it's just that same cookie cutters, plan in functional medicine. But that's kind of the struggle that people have in traditional medicine is that, if you're given a 15-minute appointment, how are you, and the doctor gets frustrated too. How are you supposed to know what's going on and how you're supposed to collect data? But at the end of the day, it's more of a pharmaceutical treatment plan. So sometimes the goal is which pharmaceutical is going to be the best fit for you. And if that doesn't work, then what's our next 2 or 3 as backups? Or is the treatment plan to find the next specialist, or is the treatment plan to send you to a physical therapist? And I think that it's not a very comprehensive, but that's the best they can do in the short period of time. And so that's what makes my world different is, we'll spend 2.5, 3 hours and then another half hour going over their information. And then our report of findings, review of findings, we'll spend another hour, hour and a half. So I think it's a lot of time on the front end because I believe if you put time in on the front end, then you don't have to put all the time in on the back end or waste money, because sometimes people just go, I think it's this. And then if they get it wrong, they go, oh, no, maybe it's this. Oh, no, I was listening to a podcast. Maybe it's this, and it's like, wait a minute, just do your work at the beginning. And it takes out a lot of the guesswork.
Yeah. So you're putting in 4 to 5 hours of work, like per client and their initial sort of meetings.
Absolutely. Yeah. So, which it sounds like it's a lot, but it's a lot. People have, people have a long history with a lot of data and a lot of records sometimes. And they're just like, I don't know where to go. They're like, here's all my records.
Yeah.
Figure it out. So
Fair enough.
It's a lot.
Fair enough. So if someone comes to you and they give you the blood work, do you look at that blood work like a conventional doctor where they have the norms on the next to the actual scores, and then they will be flagged if they're above that norm or below that norm? Or do you look at it slightly differently?
Both. And so this is what I actually tell my patients. I believe blood work should tell you a story, not a story of H's and L's, because that's all you see on blood work. And they go, oh, that's high, you must have an issue.
Yeah.
It's not that. It should tell you a story. So as we're going through blood work, it should all of a sudden come off the page, so to speak, and go, all right, you have dehydration because your electrolytes are imbalanced, because your blood sugar is off, because you have an infection that looks like it's viral. And that's what it should look like. So I look at the conventional ranges, because if you're outside of those ranges are there for a reason.
Yeah.
To look at diseases and conditions. But then you have another set of functional medicine ranges, and those functional ranges are smaller and tighter. And so those kind of give you optimal ranges, so to speak. But what I like about those ranges is that they kind of tell you a trend, like which way you trending. It's kind of like Twitter. This is trending and this is trending, so like glucose, for instance, or blood sugar, the range is 65 to 100 in traditional medicine.
Yeah.
I can't tell you how many times I've seen patients at 66 and they're like, my doctor said I'm fine. And I'm like, dude, if I was at 66, I'd be a hot mess, but they're within range. And so they're fine. Or you see people that are like 99, and they're fine. And I'm like, dude, you shouldn't be 99, you should be 65. And the functional medicine range is like 85 to 100. And so, that's kind of a great example that if you're trending and everything's showing that you're kind of on your way to like pre-diabetes, we should probably be proactive and not wait until you hit diabetes and now you get a medication.
Mm-hmm.
And I think that's where the functional medicine world comes into play too, is like, which way are you trending? Where are you going to go in life if this doesn't get fixed? And how do we turn that around before it becomes something that's really hard to fix? And that's, I think, the difference in the functional ranges and the traditional ranges.
And I think that's beautiful, because that leads us into a person seeing their GP for a general health check, sorry, in the UK, they're called general practitioners, a general health check, all the bloods come back within normal ranges. Doctor says, you know what, you're fine, clean bill of health. And let's say they're 45 years old, like me, and they're off to the races. They come and see you, and you say, well, actually, yes, you're in all within normal limits, but there's this trend that I'm seeing in your blood work or in your hormone panels that could lead you towards a diabetes or something like that. And we're going to make some interventions now that will change that. And this podcast is called Your Lifestyle is Your Medicine. So what lifestyle interventions do you give someone who, for example, we can talk about pre-diabetes because it's so common. What would you recommend for someone with pre-diabetes?
Definitely lifestyle is a big factor. I mean, it's interesting. It's interesting that we're doing the podcast this week because our Monday morning meeting, and I'll diverge for 30 seconds, but our Monday morning meeting, we're talking about, some of these like really interesting conditions that people, like cancer, where people have a bucket list, right? And they say, you know what, I got a year or two to live. I'm going to go live out my bucket list and tour the world and do whatever I want. And lo and behold, they somehow beat cancer, and now they're jobless and homeless and ran out of money, and so I think when you talk about lifestyle, that definitely plays such a huge role because, if you have a high stress life, whether it be your family, your job, even your health, I mean, that really plays a role into it. And, and I think I had this conversation with somebody this morning. We were talking about stress and, you may not think you're stressed, but if you took a step back, you would say, man, I'm in a lot of stress. And stress has an impact with your adrenals and with cortisol. And so if you're in a constant like fight or flight mode, then your body has to kind of like subsidize that. So it says, well, there's some storages of glucose we'll keep dumping into the system because we got to keep you alive, but you're not moving. Now you're just sitting at a desk, or you're not exercising as much as you should. You're more sedentary. Mm-hmm. So then what happens is you're constantly driving glucose into the system and time again, day after day after day. And then that starts to raise that blood sugar. So it's kind of an example of how like lifestyle can be more detrimental to blood sugar health than just poor eating habits. Mm-hmm. But that's a whole lifestyle too, because if you're eating poorly, that's going to lead to, high blood sugar. And then you can add sleep. If you're not getting adequate amounts of sleep, that can create a stress response. So now you have a traditional American, it feels like, that's stressed out, sedentary, and not sleeping well. And now they're just trending towards prediabetes and other health conditions.
And what would you recommend for someone who, has those conditions? How would you recommend they manage their stress?
Yeah, and that might be the hardest part about being a doctor.
Yeah.
Because I think you have some patients who are incredibly motivated. And then you have some other patients who are not for whatever reason. And you have some patients that can see the stress and move on. And you have some other patients that, I have a kid with special needs. Mm-hmm. You're never going to change that. But that creates the stress of my world, and so if a doctor was like, oh, you'll be fine, just try to figure it out. It's like, it doesn't work that way. So I think that is the hardest part about being a doctor is how do we change their lifestyle? Unless we set up a reality TV show, we sat at their house and we coached them. And that would be a really interesting practice. But I don't know. I think at the end of the day, what I try to do is I try to educate. If I can educate them and then have them work on small things as we go along, then I'm hoping they start to see those changes. Because if they notice, hey, I'm sleeping better, and because I'm sleeping better, I have less brain fog. Because I have less brain fog, I'm able to get more done at work. Hey, then that's a win. Yeah. If all of a sudden they don't have a migraine and they can go to their kids' baseball game, that's a win. Mm-hmm. If they can go for a walk, then that's a win. I don't care if it's 15 minutes, And so in some aspects, you have to start small and have those small wins so that they feel that and they want more of those wins. Because if you make the goals so big and they don't reach those goals, they get discouraged and they shut down. Mm-hmm. And so sometimes you feel like as a doctor, you're playing a counselor, but you're not a counselor, but you need to encourage them and love on them and advocate for them. But then every once in a while, kick them in the butt.
Exactly.
So I don't know is the answer.
I love it. And the way you answered that is so interesting because there's a big trend in, the biohacking world to say, well, you know what? You just got to give them more glutathione, or you just got to give them something. And I'm the same as you. I'm like, whoa. If the person's not sleeping, no supplement in the world is going to trump sleep. And if the
No.
person is not sleeping, then they're going to potentially, like you said, the cortisol levels up, and they're going to reach for more sugary foods the next day. So like the supplement cabinet is useless in this situation. It's like these building blocks of health. You get those dialed in, and then we can start talking about the fancy stuff in the future at some point.
Absolutely. Because those are kind of fringe therapies in some regards, right? Because you have to get your foundation set. I mean, and I 100% agree with you. And I feel frustrated sometimes when you talk to patients and they have a whole entire cabinet dedicated to their supplements. And yeah, biohacking is awesome. And, and some of those things are amazing, but, yeah, you can get maybe person A to do cold plunges every day. I mean, yeah, the research around it is brilliant and beautiful and amazing. But if they're a CEO working 60, 70 hours a week, when are they going to do a cold plunge? And sure, if they do it, it changes their life. But then you have like those companies that then take that person and they're like, CEO of this company started cold plunges with my protocol, turned their life around. So it's going to turn everybody's life around. Yeah. Like, that's not how that works either. So yeah, I think it's a lot of advocating and support and community. I think it's a lot. I think that's the hardest part of this job. If everybody did what I said, I wouldn't be stressed out. No. I'd just go home.
Exactly. Wouldn't need you. So, okay, maybe I'm going to ask you a difficult question to put these things in order. But let's say you've got exercise, nutrition, sleep, stress management, and relationships. Those are the sort of the foundations of lifestyle medicine. Is there a hierarchy that you've noticed in your practice amongst those things?
Sleep is number one.
Okay.
I find it almost really hard to get people better if they don't sleep.
Yeah.
So I would say sleep is number one. I would say stress management might be number two. I think it's hard, but I think if you're constantly stressed, that's really tough to do. What was your next three? We had exercise,
nutrition, and relationships. And actually, there's another one. It's avoiding toxic substances. But I kind of take that one as read. Like, let's avoid the toxic substances. We can take that one off the table. But
yeah. I think movement is huge. Because I think movement can be anything. It doesn't have to be going to the gym. It could be HIIT training, it could be walking. I think movement is huge. So I would probably say in there, maybe even, actually I'd revamp this. I would almost say maybe sleep has got to be number one thing that we have to fix. Number two is getting people to move, because if you move, then you activate your brain. If you move, you increase circulation. If you move, you get endorphins. If you move, you can reduce cortisol levels. So I think movement has got to be number two. And then I would say relationships, because I think, one of the things that's fascinating is, I got some mentors and people I hang out with, and how many of those people will talk about like, unresolved issues, unforgiveness, still being mad and holding grudges. Some of those dynamics, they can destroy you from the inside out. So I think if you get some of those relationships, whether it's coworker, family, community, then, how much that right there could start helping with the stress and, and then nutrition.
Yeah. I mean, they're all interrelated, and it's kind of arbitrary to break them out. But I'm always interested to see, which lens people look through. You'll have people say, well, it's nutrition. But generally people say sleep is number one, because you can't eat your way out of a bad sleep. You know what I mean? And you can't exercise your way out of a bad sleep. So sleep, I think, is number one. So going back slightly, you mentioned some mentors there, and those mentors were talking about relationships and, unforgiveness. Let me just ask you this. Are those mentors older than you are? Are they at the end of their careers?
Yeah, I would say yes. I would say they've always been older. And I would say, now I've been in practice almost 20 years, and I would say I'm starting to understand the consequences of that,
Yeah.
because I think when you're in your 20s and early 30s, you're like, whatever,
Yeah.
get over it. But it can eat you from the inside out.
Yeah.
If you're not careful.
It seems to be the way, doesn't it, that the more senior people in these professions have a more philosophical view, and they're not so interested in the minutiae or the latest fad or whatever. They're just like, well, why do you think that is? Is that the wisdom of years?
Oh, that's a great question, because I feels like sometimes I'm like shifting into that next phase,
Yep.
because I've had doctors and that are my associates that are younger than me, and it's always kind of funny. I've had nutritionists and counselors and doctors and nurse practitioners, and it's funny because they bring up these like fads, and I'm like, that's super cool, but they're still not sleeping, so I don't know what to tell you.
Yeah.
Or that's super cool, but did you talk to them about their marriage? It's totally falling apart, and there's a massive split in the whole entire like family unit, and sometimes they look at me like, what do you know, old man? But yeah, I feel myself like transitioning from the latest and greatest in research and fad and this and that to like, there's foundational things that it doesn't matter how many times you do saunas and ice baths and glutathione and NAD and peptides. If you're still going home and fighting every night with somebody, I don't know how far we're going to get.
Exactly. Yeah. And I love all those things you just mentioned, because those are hot topics at the moment, and people get so excited about them. But you're right. It's like this foundational practices are key to longevity and that health span within your lifespan. So I'd be interested in potentially a case study, if you have one, or a case example of someone who has come to you with sort of strange symptoms, and you and your team have found something, and then they've had a result coming out the other end. Because the reason I ask this, I always find it interesting to see who springs to mind when I ask you. You may not be able to think of just one person, but if you can, that would be great, because people listening will be like, oh yeah, that's so interesting. And it might spark something in them with a family member or a friend or a colleague, and push that person to go and see a functional medicine practitioner.
Oh, the crazy. We actually every week we go over successes in the office.
Excellent.
Because I think we try to remind ourselves that
successes
we do good work.
Yes.
So I mean, those things come to mind. It's interesting because there's so many different topics. I think probably one right now is kind of, I guess, things seem to come in waves. I would say right now the waves are kind of like tics and Tourette's, which is really interesting. So we're starting to see a lot of those, and I think with especially a lot of the kids, and so we're kind of seeing that with tics and Tourette's, it could be a neurological disorder, and we can add OCD in there too, because you can kind of get tics, Tourette's, OCD. Some of those like anxiety disorders can float in there, but so what we're doing, is we look to say, okay, which part of the brain is this coming from, and which part is developing well, or in a concussion setting, which part was damaged. And so, so then we're doing some like neurological rehabilitation. We're doing some like balance, stability, core, fine motor movement, just to kind of drive those motor aspects of the brain, so that we can help what's called the basal ganglia be able to gate movement. So all your motor activity has to be gated, whether it be emotions or movement. So sometimes even anxiety and emotional issues are because your brain can't gate the emotions properly. So that's why you see a lot of times like tics and stress and anxiety tend to go together, because they can't gate movement and they can't gate emotions very well. So we start working on those gating mechanisms from a neurological standpoint. And then we look at diet, because diet can play a significant role. You look at some of these things like, there's gluten-based Parkinsonism, for instance. There's, wheat can cause some of these neurological imbalances. There's gluten-based ataxia. So then we start looking at some of the gut dysfunction. We make sure that their blood sugar is stable. They're not eating inflammatory foods, kind of do more of a paleo towards an autoimmune paleo diet with these kiddos, and then we say, okay, we got to get the inflammation down, get the brain fired up again. And then we start looking for like infections. So sometimes you can have strep infections that lead to this, or viral infections, and then we can put together, like homeopathics or some of these nutraceuticals that can really be supportive of reducing the viral load while we're trying to work on these systems. And I would say that's kind of what seems to be coming across the desk quite a bit lately, which is really fascinating because we have zero marketing out there for it, but we seem to get a lot of those all of a sudden. But those are kind of the things I think it's good for people to know that there's more, there's so many different things that affect the brain.
Mm-hmm.
It's not just, hey, let me go do brain exercises and everything will be great. So I think the nutraceutical, the gut rehab, I really love glutathione for these
Mm-hmm.
kids. I mean, so we'll definitely do like glutathione. Um, Maybe turmeric is really
Mm-hmm.
good as reducing brain inflammation as well. And so we use some of those nutraceuticals to also support them.
That's so interesting. I hadn't put together tics and and OCD with functional medicine before. So
Yeah.
you opened my eyes there. I didn't know that was in my mind I'm like, okay, you're a chiropractic neurologist that is you're going to be head and shoulders above most people when it comes to concussion. And you're a functional medicine practitioner, therefore you'll be head and shoulders above people with blood work, thyroid problems and so on. But OCD, I mean, man, I didn't see that.
Yeah. 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 That was hard. I mean, we actually had a patient today that, I mean, he had OCD and just perseverating on emotions and thoughts. I mean, we had this conversation in the office just before I got on with you because, it's like, he's like, okay, I got my handle on it. And he's got some massive adrenal issues. And it all happened after COVID. So he's got a little bit of long hauler stuff, but he got some
Yeah.
adrenal issues, and I got to check to see if there's like a neuroautoimmune condition. But we did like one little thing, like one little exercise, and it just flared him up. So then we had to spend like the next hour, like, okay, what the heck happened? What's going
Mm-hmm.
on? But it's like his whole anxiety system, is just going crazy. And so it's like, so now we're looking at like neurotransmitters, and what is that role? But he's got all this nausea and gut issues. And so I'm like, okay, is it the brain causing the gut or the gut causing the brain? Who's playing what?
Mm-hmm. Mm-hmm.
And so they're really fascinating, but functional medicine can definitely have a role in a lot of these pieces, but there's so many pieces. There's so
Exactly.
many.
And what's your favorite thing to treat personally?
Um, I mean, probably one of the more favorite things is like vertigo. Vertigo, I think is, because you do things that kind of feel easy. That
Mm-hmm.
one seems a little bit easy. I think some of the easy stuff that's kind of fun. I actually do like migraines and thyroid
Mm-hmm.
from the functional medicine standpoint. Thyroid to me is really, really easy, but I also lecture on that. So I kind of know it inside and out.
Mm-hmm.
But most of your thyroid dysfunctions are Hashimoto's. So then it kind of goes into the autoimmune world. So once you kind of figure out the autoimmunity and the triggers, then things start to get better pretty quick. So that one's really kind of fun to work on. And I gave you 3, I know, but like migraines, I really like that too, because I think a lot of people are suffering from migraines that are just going from doctor to doctor. And I can't tell you how many times they're just anemic and no one ever looked
Right.
at iron. I mean, I feel so sad for some of these people that like migraines for like 5-10 years. And I'm like, here's a bottle of iron.
Yeah. That's it.
And then like in 2 weeks, they're like so much better. So I really like those kind of conditions because I think you can fix them a little bit faster,
Mm-hmm.
and they have some big rewards. So
Exactly. Yeah. It's the big rewards, isn't it? For little intervention, big rewards.
yeah,
Yeah.
because I think as a practitioner, that's what keeps us going. Because I love what I do, but it's not because it's super easy.
Mm-hmm.
It's every patient is complex, and every patient has been through the medical world and 18 doctors and a binder of lab results. It's like it's not super easy. So when you get those like easy cases that you didn't have to intervene and they changed their life, you're like,
Mm-hmm.
it's like a good golf shot. You're like, I'm coming back tomorrow. This is
Exactly.
great.
Whereas if you only remember the bad golf shots, you're not coming back the next day.
Not at all.
That's so interesting. Yeah, I mean, I specialize in musculoskeletal medicine, and it's the same. It's when I get a patient who's, had their MRI and they're like, "Oh man, I got to get surgery, and I'm really worried about this." And I say, "Well, you know what? Let's just give it a few treatments, and we'll see." And then 3 treatments later, they're like, "Oh yeah, I'm 100% better," and I'm like, "Great." So in their mind, they've gone from the absolute low, the point of having surgery, to the back to normal. And in my mind, there was not a really big problem in the first place, but that's only because of the years of experience and so on and so on.
Yep.
Yeah.
Yeah. Yeah. Those are the best.
Yeah.
Yeah. Because you don't want to say, this is not a big deal, because then you totally like, you don't validate anything that they're feeling. So you can't be like, oh, this one's easy,
Yeah.
but in your head, you're like, well, this is not that big of a deal,
Exactly.
and they're like, I can't function. It's the depths of despair, and then whoosh, they're all better. It's those are fun. Those are good days.
Fun. So let me ask you, how will people find out a little bit more about what you do and about functional medicine and chiropractic neurology?
Yeah, so my office, we're constantly out there. We're always trying to dish out information. I mean, even tomorrow night, I'm doing a webinar on migraines, and then I think we're going to switch gears and go into like male hormones. And I think we're going to kind of hit that pretty hard with like articles and webinars and things like that. So, I mean, to find me out is always good because it's just another place to grab information. But, so, I love the word integrated. I swear I might have been one of the first people to come with that term, and now everybody has it. But, so mine is integrated health. Denver.com, so which is easy. So I mean, I'm really big into integrated health, and then I actually kind of have a subsidiary, which is same space but different name that people can find as like Integrated Brain Center. Okay. And so those are kind of the two things. It kind of just tries to depict what we're trying to do is integrate the body. So Integrated Health Denver and Integrated Brain Centers.com. But we're also on social media and Instagram and all those pieces where you can follow and see what we're doing. And, we're on the radio every Monday talking about topics and doing webinars and throwing out articles and podcasts. I mean, it's great to have me on here because it's stuff that we can put on our website and, and say, hey, here's more information on functional medicine. So I think your second question, I think it's sometimes hard for people to find and understand what functional medicine is. Because I think in our world, there's so many different types of functional medicine, if that makes sense. Yeah. You have some of those practitioners that functional medicine is food allergies on everybody. Another person does parasites on everybody. And then you have, some of those like me that really include a lot of things. And so I think it kind of confuses the public a little bit. Right. So, I think what's really good for people is to interview and say, like, what do you do? What's your style? What's your philosophy? And do a free consultation. I mean, that's never going to hurt because I think it's always good to find out, is it a good fit for you? If all they do is specialize in food allergies, maybe that's a great fit, but maybe go find somebody who's looking at the bigger picture. And some people are all about IVs and they're calling themselves functional medicine people. It's like, right. So I think maybe look for somebody who's very integrated and has a big understanding of different systems. And I think with functional neurology or chiropractic neurology, again, that one's really kind of hard because I think chiropractic neurology is kind of the term that we use, but functional neurology, I think we're trying to depict the same things on functional medicine. Like we're going to look at the entire function of the brain and decide what's the best way to fix it. So that's kind of the term that is kind of being coined out there, but it's not a profession per se, but I don't know. Maybe just go to my website and just read. I don't know. This is why I like doing podcasts. We got to educate the public.
Exactly. And also I like the fact that, you mentioned doing men's health coming up. I'm sure some of my listeners will be interested in men's health. So they can go to your podcast, go to your website, subscribe and get on those webinars.
Yeah, that's a big deal out there that we are kind of talking about it. It's like, you have all these low T centers that are out there, and I appreciate what they're trying to do, but it's like a cookie cutter approach. It's like you have low testosterone and here's 12 months worth of shots. Yeah. I'm like, you're not getting to the root cause.
No, exactly. We need to find that out. That's huge. And men's health is, something that's near and dear to my heart, obviously being a man, but also with the clients I treat, it's people don't know what to do, when in women's health, for some reason, sure, women's bodies, they suffer from different things from men, but the pathways seem to be a bit clearer. And for men, it's like low testosterone and they're like, well, okay, I don't know. And that's it. They just don't know.
Yeah. or they just run free and total testosterone. Apparently that's going to be your entire treatment plan.
Right. Or that's
a lot more. Oh my gosh, it's no different than running TSH and thinking you just found out what's wrong with the thyroid. There's 7 other markers. Yeah. And that's how it is with men's health. There's a bunch of other markers that tell you why. You just need to go actually work up the case.
Exactly. And that's why we need people like you to do that for us. Okay. Thank you, Shane. This has been fascinating, but I have to wrap it up, unfortunately.
Absolutely. This has been great.
And I would like to get you back on another podcast at some point and we can go into a deep dive on one of these topics.
Anytime. I'm all yours. Just name the time and date and we'll figure it out.
All right. Thank you. Take care. Bye-bye.
Thanks.
Shane is a pretty smart guy, and he's also agreed to come back on the show and talk about blood sugar in relationship to the specific types of diet. So paleo diet, we have keto diet, or we can have a high carb diet as well. We're going to look at blood sugar and how that can be affected by those diets in a future episode. If you like what you listen to today, make sure you like and subscribe to the channel wherever you get your podcasts. Leave me a review if you can, and I would love just a little comment and a star rating as well, because those star ratings and comments help drive the algorithm up, and more people can listen to this podcast and learn about how to use lifestyle as their medicine.